For years, I've said that a system where doctors are left to wonder if they'll get fairly reimbursed makes absolutely no sense.
Current payment formula isn't fixed. Physician fees will be cut by about 5% each year until 2016. That's a 40% cut over 9 years.
What's going to happen is that the physician just can't afford to see the Medicare or the Medicaid patient. It will cost more to see that patient than the patient or the physician will get back. So they'll be forced to not see those patients.
Unfortunately, family medicine is a business, has to be run as a business. If we don't run it as a business, we end up closing the doors and nobody gets care, which is not what we want. It may cost me employees. It may cost not replacing equipment that needs to be there, like x-ray machines, lab machines, whatever, which adversely affects my patients.
Over a period of time, we cannot have a system that doesn't have good primary care physicians at the front end.
Obviously, we're going to have to make a fix. If we want family physicians to actually be able to afford to take Medicare patients, we don't want to see people finding that when they go to a doctor that there's actually an office policy now because those reimbursements are inadequate. And I'm particularly concerned about family physicians because, you know, there's a lot of talk now about a medical home and what an advantage that is for people to have their family physician, someone that they know a relationship with. And yet, if we don't reimburse properly, there's not going to be any time at all for those physicians to spend with people.
In our office, we're contemplating having to lay off half of our employees because of these cuts, and we just don't know how we're going to be able to keep seeing the Medicare patients, and we are seriously considering stopping to see them.
Their reimbursement, as I mentioned earlier, is so low that I would have to see nearly 20 patients an hour to make any kind of reasonable reimbursement on it. In our community, with decreasing reimbursement, many of the primary care physicians have gotten off of Medicare. So because so many physicians are getting off of these insurances, it's very hard to find places to send the patients. So a lot of our Medicare patients are having to go to the emergency room. If a person who has $350,000 worth of education and 17 diplomas can't afford a 1,500 square foot office, what does that tell the young people in our country about education?
All physicians will receive a 21% pay cut from Medicare. More to the point, the following year, another 21%. So I don't see the problem getting better.
Now, if you're a doctor and you're taking a Medicare patient and you know you're going to be cut by 21%, you going to take that Medicare patient if you have an alternative, take another patient? No.
I'm Dawn Buckingham. I'm an ophthalmologist from Austin, Texas. The Medicare cuts will basically close our practice. We would have to fire half of our employees to take that hit in the overhead. Currently, most practices operate at about a 3% margin. We see so many patients for free that we just can't afford to keep our doors open or to keep our employees employed or to be able to see patients if the Medicare cuts go through.
The number of primary care physicians in my community are steadily going down. If you are I'm president of our local medical society, and if you are a new Medicare patient in our community right now, new Medicare patients take at least 6 to 8 months to get into any kind of health care, and most of them will go to a federally qualified health care clinic that we have that is federally supported. You can't find a private practice primary care physician who will accept a new Medicare in Lincoln, Nebraska today.
My name is Madeline Butler, and I'm an obstetrician gynecologist from Tampa, Florida. Well, I've already had to make the unfortunate decision to stop seeing new Medicare patients because of the cuts. I think that as a small business person running a medium to large size OBGYN practice, I have to have dependable income every year. And a 20% cut and unpredictable cuts every year was something that I couldn't live with. And most of the quality OBGYN practitioners in my city are not taking new Medicare, so it's already had an impact. So it's devastating for the elderly population, which we have a lot of in Florida, because it really affects their access to good physicians.
Particularly in my area, we're in an underserved area. We're in the Delta of Arkansas. We are a poor community, and it's hard to attract physicians to come to our community to practice. adequate reimbursement will help us to attract the physicians that we need in our community to continue to provide quality care to all people, and in particular Medicare patients.
My name is Kim Crone. I'm a family physician. I practice in Minot, North Dakota. We're always concerned in our practice when Medicare cuts are mentioned or actually happen, because we can only take so many cuts from so many payers until we can't afford to practice medicine anymore. I actually work in a residency clinic. We're owned by the state of North Dakota, so we pretty much have a mission to serve all the members of our community. So there will never be a question that we won't see Medicare patients in our practice. However, at some point it won't be sustainable for the state to run residency practices such as mine if our reimbursement sources are not actually paying for the cost of the care that the government has taken the obligation to cover.
My name is Jennifer Weiler. I'm an emergency medicine physician practicing in St. Louis, Missouri. I think access to care is the most significant problem that patients face. If they can't get to their primary care physician because because the primary care physician couldn't afford to stay in practice because their medical malpractice premiums were so high, it forced them to close their doors. The exacerbation of their chronic disease becomes something that could have been preventable. The cost of medications is skyrocketing, and many of the patients I see can't afford to fill their prescriptions, so I see them return to the emergency department over and over for their asthma attacks because they don't have the resources available to be able to get that medication. I see patients from miles and miles away who are seeking care for diseases that have just spiraled out of control, when if they had been able to see a specialist earlier, it might not have gone to those extremes. But because we just don't have the resources available in some of the rural communities, patients are forced to suffer.
Medicare is a promise that we've made as a society to our elders, and we are failing to keep it if we fail to support the system that cares for our elders.
My name is Melvin Sterling. I practice in Orange County, the city of Orange in Orange County, California. I practice internal medicine and palliative medicine. If my congressman or senator were here right now, I would tell them to wake up. I would tell them to look at the studies that show that less than 2% of graduating seniors in medical schools are now going to go into the primary care disciplines that serve the Medicare and Medicaid population. I would tell them that access to effective, humane care for people with terminal disease is going to disappear as the pool of new doctors disappears and we have nobody to provide the compassionate care that every single one of us is going to require.
Not be able to continue to take care of our elderly patients. We need Congress to act.
These doors will close to new Medicare patients. We don't have a choice.
The solution has to be an evaluation of what it costs physicians to take care of patients and what their care is worth. And when you see that there are doctors out there saving lives and getting reimbursed nothing for it, time and time and time and time and time and time and time again, not just every now and then, but again and again, there are life-altering interactions undertaken that are completely unreimbursed. And when you see that and see the basic unfairness of that, you will come up with a solution that looks at what does it cost to get that kind of benefit and how can we make it work.
I'm absolutely willing to take the difficult steps necessary to lower the cost of Medicare and put our budget on a more fiscally sustainable path. But I'm not willing to do that by punishing hard-working physicians or the millions of Americans who count on Medicare. That's just wrong. Congress must act to prevent this pay cut to doctors.